Good afternoon, everyone. Thank you so much for joining us today. We wanted to take some time with our DME provider community to discuss some flexibilities that we have received through a waiver request with CMS, and also give you an opportunity to ask any questions on things that are currently going on or things that we may need to request in the future. So I'm going to turn it over to Traylor, and he's going to overview.
Hi, good afternoon. Thanks again for joining us. I'm Traylor Raines, Deputy State Medicaid Director at the Oklahoma Healthcare Authority. Thank you all for, let's see, just making sure everyone can hear me. I got a response that we can't hear. Corey, is there sound on your end, and Mel?
There's sound on mine.
Okay. So we want to give you an overview, as Mel mentioned, on the flexibilities that we've been given by CMS, our federal partners, during the emergency period. As you know, the president declared a national emergency due to COVID-19 on March the 13th. We, in turn, on Monday, March 16th, began making accommodations for our providers, mostly through enhanced use or expanded use of our current telehealth network. Have opened most specific provider group. We ask that you label updates, and that OKHCA/globals. We've also created a COVID-19 response on our public site. That's okhca.org/COVID-19. We will create the written responses to any questions submitted today and post them to the COVID-19 page, along with a recorded version of this webinar. So, touching back on our 1135 waiver, we asked for certain flexibilities in this time in order for our providers to be more agile in how they provide services, given that we understand a lot of that cannot be done face-to-face anymore. One of the things we got flexibility around was our provider enrollment. Typically, as you know, we require certain things to enroll as a Sooner Care provider, such as site visits, enrollment application fees, and fingerprint criminal background checks. All of those things during the emergency period, we have the flexibility to waive if we have a demonstrated need for more in-state providers to provide this service. So our provider enrollment staff are looking at those on a case-by-case basis. And so if you have providers that you're trying to enroll at this time, please use the normal processes and emphasize to provider enrollment staff if you need to use the flexibilities we've gained through the 1135. Another thing to mention is you've probably seen that there's been several pieces of federal legislation come out in response to the national emergency, the first of which was the Families First Coronavirus Response Act. Part of that act gives each state Medicaid agency an enhanced 6.2% FMAP. So, our program is run based on state dollars that we then are matched by the feds at a certain percentage. So they're adding 6.2% onto our regular FMAP in order to assist states with, in turn, helping providers continue to provide services, pay for any additional services or costs that the state has incurred due to the response. And one of the conditions of receiving that is that we will not make any member eligibility adverse decisions during the emergency period. So that means if someone was about to re-enroll or renew on for Sooner Care during the emergency period, we have pushed those enrollments out right now for 60 days, and we'll reevaluate based on how long the emergency period continues. We will also not make any adverse on fluctuations in income level, categorical relationship, or other eligibility factors. The only reason that a member should lose eligibility during this time is if they choose to be unenrolled from Sooner Care or if they're no longer a resident of Oklahoma. For purposes of member eligibility, the emergency period began on March the 18th. So I would say if you come across any of your clients that have been terminated, things happen, and want to make sure that no one loses coverage during this period. So specific to DME, and why I have on with us today from our Medical Authorizations Division, as well as Natasha Kester, that can help responding to direct question. But we know with DME, there's the requirement that a physician prescribe it. And so during this time, understanding that individuals can't necessarily get in to see their physicians, and also that a lot of times there's not ways to get that updated prescription. We are accounting for if we see case notes, need for the continued product or supply, use that instead of a physician. Refer to Natasha if there's anything additional around that respect that I left stated, and far I haven't seen any specific Q&As.
Trailer, this is Natasha. You're kind of breaking up on my end, so I wasn't really able to hear exactly what all you said.
Sorry about that. So I just wanted to make sure that I didn't leave anything out, or if there's anything you could provide by way of guidance and around flexibilities that we have provided to our DME providers.
Some of the flexibility that we've provided right now, like you mentioned the signatures. We are waiving some of the signatures as long as the documentation within the medical record indicates that the member needs the services. I know for oxygen authorizations that were currently in effect with an end date of March or April, we have extended those authorizations out for 90 days. And we have done the same thing for enteral formulas. If your authorizations ended in March or April, we have extended those authorizations out for 90 days as well.
Thank you for that. And there was a question to repeat the information around physician prescription. Natasha, would you mind giving more detail around the physician prescription and requirement flexibilities we're giving right now?
Right now, what we are doing, we are going to waive the signatures on specific items if the documentation, the medical records, because even though we're going to waive requirements, we still have to have proof that it's been ordered or deemed necessary for these physicians. And so as long as the patient's medical records indicates the need for things such as your enteral therapy or your TPN therapy, we will waive those specific signatures like on the CNNs. We will waive the signature on the CNN as long as the medical records indicate the need for the service.
Thank you for that. So in looking at the Q&As, it looks like there's a question regarding behavioral health services. I would direct you to our COVID-19 response page. We have posted all of the recorded webinars on that page, along with answered Q&As. We had a behavioral health session Thursday, I believe. So it was a really good session. We had a lot of attendees, and I believe all the questions you're asking were responded to during that session. All right. Are there any other questions regarding durable medical equipment and supplies and billing during COVID? So let's see, Natasha and Jacqueline, there's a question, will the PA for a hospital bed be required at this time? If so, what specific documentation needs to be obtained for this?
The hospital beds, there is still a requirement for the prior authorization for a hospital bed, and the same requirements prior to the COVID-19 will still be in place for the hospital beds.
And let's see, there's another question. Are there any changes to the date span? I think you might have just touched on that. Is that, let's see. Ms. Borkowski, was that in response to the PA dates ban? If so, I think we responded to that, and we will get that in writing as well, posted to the website. Oh, the billing date span. Natasha or Jacqueline, do you have any thoughts on that? Changes to the billing date span?
Jacqueline, I'm gonna refer that one to you. Okay, so we touched on that a little bit, kind of went back and forth. So I will actually answer that. I'll get back to you on that in writing.
So there's a question about Medicaid was supposed to start covering CPAPs, but we were told it was put off until July. Will COVID delay this? Go ahead.
Go ahead, Trailer, sorry.
No. I was just about to say, I'm not sure. I'll defer.
On the CPAPs are currently covered for children. They're not covered for adults. The adult coverage of CPAPs will start July 1st of 2020, and as of today, there is no plans to put that on hold.
And going back to the hospital bed question, there was a follow-up. So as I understand what you just said, patients still need a face-to-face for hospital beds, and is it the same for lifts?
Jacqueline, can you answer the face-to-face on that? Okay, sorry about that. There's some internet acting up. So on that, we are currently keeping everything as is. So we are still requiring the face-to-face. Now, if there is a reason that you feel like that cannot be done, please, within the Q&A section, just kind of add to your question, or you could also reach out to our email address, which is D as in David, M as in Mary, E as in elephant, admin, ADMIN, at okhca.org. And you could email that information to us, and what we'll do is we will get back to you that way also in writing. Thank you.
So there's a question that's come up, and it's come up in several other venues as well. This one specifically says, I had a DDSD caseworker tell me that after June 30th, PAs for our patients will have to go through the DME. Is there protocol as to how to submit these as of July 1st? Will Advantage program follow the same guidelines? This is only 2.5 months out. So yes, that requirement will still go into effect July 1st. That is with regard to all of our waiver programs. We are currently in the process, and we can get you that information in writing as to where our provider trainings will be held on that. I know they're setting that up. I've also asked staff to create written guidelines and guidance to providers around this that should be forthcoming shortly. So if oxygen auth ended prior to March and April and patient had upcoming appointment, but now cannot see the physician, will there be an extended 90 days, or do we need to send a PA request noting this and get an authorization? For example, auth ended in February and appointment was scheduled for April. Jacqueline, are you able to answer that one?
So on that, Trailer, did they specifically mention what type of PA they're referring to, or are they just talking in general terms?
Oxygen prior authorization.
Oh, oxygen. Okay, thank you. So on the oxygen, as Natasha had mentioned, there's ended in February is what they're saying. If you will email the DME admin email, which I added onto the chat screen as requested, if you will send in information regarding that specific PA, then we can take a look at it and reply to you in writing on that. Thank you.
And just to respond to everyone as well, I'm getting a couple of questions. We will respond in writing to all of the questions submitted today and post them on our COVID response page. That address is okhca.org/COVID19. And Corey in the chat box as well, so you have access to that link. There's a question around, can we now dispense DME from our PCP office if we are the patient's medical home?
Natasha, I will let you take this one. DME has to be issued by a durable medical provider to receive payment. So you have to be contracted as a DME provider to receive payment for this.
Are patients able to receive more than a 30-day supply at this time?
That's going to actually depend on the code that the member is needing to be serviced for. Some codes are restricted to only a 30-day supply. Some are not. So I would have to have specific codes to review and then answer that at a they would email the DME admin with the code. Then I can look those up and respond back to the providers with that.
So I'm seeing multiple questions being directed to the chat box. I will remind everyone, if you want a question to be considered and answered to in writing, please direct Q&A box rather than the chat box. There's the question, what about the need for new AAC devices? Are there any changes?
As of right now, there are no changes to the requirements for the AAC devices. They will still require a prior authorization, and they will still require all the documentation that's currently required, such as the video of the patient using the item, along with the supporting documentation.
So there's a question regarding the new reimbursement methodology that is set to take place July 1. And whether or not there's been any decisions to postpone the new rates based on the COVID-19 emergency crisis. Natasha, have those conversations occurred, you know?
I'm gonna let Jacqueline take that one. She's had discussions with Dr. Burdett in regards to that. So far, everything is still on track for the July 1, and we have not had any discussions with postponing due to the COVID-19. Thank you.
All right, we'll give it another minute or so to see if we receive any more questions during this time. Seeing none, I will refer back to Melody for some closing thoughts and to wrap our session up today.
Okay, thank you again for attending today. I do hope that this was informative, and please remember that all questions will be answered and posted on our website. I know that there was some static in the background, so we'll make sure that all the information is available. And so just to close this up, thank you all for everything you do. Thank you all for being available to our members during this crazy time of COVID-19. And please let us know if there's anything that you would like us to consider as a flexibility with our federal partners. And we will be more than happy to repeat this session if you just reach out to us, and we'll schedule another one at your convenience.